Jamaica Plain, Boston. It was a big hospital. The hospitals that we interned here were, you know, very small. I don't want to call them backwater hospitals, but that's pretty much the comparison that you could give to them. And then when I went to the VA and did a rotation there, the types of patients were pretty morbid. You know, you didn't see the drastic, or I don't want to call it. They were more severely ill. It probably had to do with the VA setting.
Because it was in Boston, or?
No, I think
just because of
it was veterans.
Which internship setting did you most enjoy, and what about it?
The VA, because it was challenging.
Did you ever find yourself in a counseling situation during your internships where you had to like counsel a patient and advise them?
I remember I did in-service for the nursing staff at the VA hospital. I forget what the subject was. I just remembered that I had studied up to do a presentation to the nursing staff for I don't remember the subject.
Did any of the connections that you made on your rotations help you find a job, like after your dad's store was closed and you found other jobs?
No.
No.
No. It was all of the jobs and all of the promotions that I acquired were on my own initiative. And it was just serendipitous that I learned that the more varied that your resume was, and the more jobs that different aspects of pharmacy gave you a real advantage when it came to applying for a job, and demanding pay also.
How would you find out about a pharmacy job? Would they be posted anywhere? Or?
Mostly they called me.
They told you?
Yeah, it was usually through the grapevine. Unfortunately for students, now that there are, you know, so many students and so few jobs, you really have to work the pavement in order to get a position. Like I said, through word of mouth, now that I think about it, I guess I was in demand. But there was a shortage also.
Did the school help students find jobs if they didn't have?
It wasn't necessary for me. For the longest time, I just had a job. So I didn't need to find out if the school offered any type of assistance for landing a job.
So besides working at your dad's store, how were you treated by other more experienced pharmacists at the other settings?
Oh, in some of the other settings, some of the senior pharmacists, when I came in, I wasn't a senior pharmacist. I was, you know, I was coming from a very narrow experience situation, and there was animosity, let's put it that way, especially coming in untrained or learning a new aspect of the industry, the people that knew what was there. But if there was pharmacies of let's say my own age bracket, they were very helpful. But the older ones, I think they felt threatened.
When you went from an intern to a pharmacist, how did your role change and how did it affect you?
I had a ready-made job to go into. So, and it was a job that I was pretty much working at for years and years. So there wasn't really that great a transition.
What were your main responsibilities and your main functions as a pharmacist?
They didn't change. They didn't change from being you would probably call my position as a clerk, or it wasn't even an intern position, it was just a clerk. And then as soon as I got my degree, I had a job, and it freed up my father to have more free time.
And what did the job entail? What were the expectations of a pharmacist?
At the time, when I graduated, like I said, there didn't seem to be a transition. You just one day you were a pharmacist, and then one day you were a clerk, and the next day you were the pharmacist. So you just assumed all of the chores that the pharmacist was doing, which you were helping him do initially, and so there wasn't that great a transition. Whatever the role was, I had already been filling it.
What was counseling like then? Did you ever have to counsel the patients? Were there limitations to it?
Counseling wasn't required until later. It was usually the rapport that you had in a community pharmacy with the patients, that if they had questions, they asked them, and because of your position as a trusted health professional, that somebody that they knew as, on a first name basis, they weren't afraid to ask the questions. And a lot of times I've noticed in my later years in other retail setting that patients were intimidated by the environment because it wasn't a community pharmacy. It was like going to white coat syndrome, you would call it, if you went into a doctor's office. So they would come to the pharmacy window, they wouldn't know who you were. Other than that, like I said, in the pharmacy setting, in the community pharmacy setting, they knew who you were. They had seen you day in and day out. I mean, my father's store had a soda fountain, and the kids that we used to sell penny candy to and milkshakes became heads of family, and they had kids, so you could see the transition from, they would graduate from grammar school and high school and then buy a home in the neighborhood or get a job in the neighborhood, and they would continue to come back.
How many of your co-workers, meaning how many other pharmacists, were female as compared to male, or was it just you at that pharmacy?
Oh, it's just me. Coincidentally, as soon as I closed my father's pharmacy for him, I got a job in a hospital pharmacy, and it just happened to be the director of the pharmacy was one of the students that we shared at Mass College. So during the rotation at Mass College, it was one of the students that we studied with. So she was a Mass College graduate. I guess that would almost be on the level of nepotism, but.
Was that rare for a female to be the director of pharmacy, or not so much?
I didn't have that much exposure to find it a rarity, so it just came as part of the territory.
What kind of hours did you have to work in the pharmacy?
40 hours. 40 hours.
Were you allowed to take breaks during the shifts?
We were allowed to take breaks because it was, so we're talking about my first experience out of retail and into hospital pharmacy, and it was a small hospital pharmacy, and it was almost like working in a community pharmacy. The hospital was small. You knew all of the nurses, the entire staff by the first name. And so there was a social atmosphere as well as a professional working atmosphere. You didn't really need a break. It was fun.
What type of benefits were offered at the job?
That was the first time I had health insurance.
At the hospital?
At the hospital setting. And then vacation time. These are all things that when you work for a family business, you don't get vacation time, you don't get sick time, you don't. So the first time I took a sick day, I think I'd been working in pharmacy for 30 years. Before I was so sick that I couldn't go to work. You just went to work. It was what you did.
Did you find that the pay changed between retail or
Oh, yeah.
community or hospital?
Oh yeah, that was one of the biggest advantages of leaving a family business. The pay just wasn't there, and then the pay increase was just so drastic. It was like, wow. That was one of the other benefits that encouraged me to get a varied experience.
So the family owned was like the lower end of the pay, and then
Oh,
community, and then
way low.
hospital.
Way low.
Did you have any liability insurance when you were practicing? Or did the companies offer it?
Most of the companies offered it, but I always carried my own liability insurance. As soon as I entered the hospital setting, there was a group insurance. I forget what it was, HSP, or whatever, hospital pharmacists or healthcare workers group liability insurance that I carried. Not so much to the reason that I carried it, I was advised that your employer would probably provide insurance to cover any liabilities that you would run into, but you had no protection from your employer coming and holding you liable for them losing money. So that's why I carried my own liability insurance. Not for the patients, but because of my employer.
Would you recommend that to future pharmacists as
Absolutely.
well? For the same reason?
For the same reason. And it's the cost of the insurance through a group setting is pennies.
What were some of the federal or state laws that were in place regarding dispensing medicine at the time?
They were constantly adding new laws, and it was usually during some of the continuing education and word of mouth through other pharmacists. The continuing education was usually offered by the local pharmacy association, and everybody knew everybody else, and through word of mouth you would know that regulations were changing, and then you were able to adapt that way.
Was it hard to rely on word of mouth, or?
Yeah, it was. A lot of times you would be surprised by a change in a regulation. The board was really not that, they weren't that good about disseminating information about changes.
What were some of the big changes that came as a surprise?
Oh. Mostly it was, the biggest change came with the advent of electronic transmission of prescriptions. That was the biggest change. Trying to keep up with what was allowed and what wasn't, and what type of penalties if you didn't, and then trying to advise the doctors or the prescribers that we were being held accountable for a certain standard, and they weren't complying. You know, one of the biggest ones was, you know, when you receive a fax prescription, that the law specifically required that the telephone number of the transmitting fax should be on the prescription when you received it. The doctors didn't even know how to program their fax machines. They just bought a machine and started faxing them out.
How did you deal with that, and how did you solve that problem?
For the most part, I just made the phone call, advised them of what was necessary, and documented on the back of the prescription that I had a conversation. And usually the documentation would be the name of the staff that I spoke to in the office. But the next time you got another prescription faxed in from them, I just repeated the same statement and the same name because I had already talked to that office about the situation. They didn't want to comply. There was almost like, we really don't need to. You know, there was a professional barrier between physicians and pharmacists. They were elitists, let's put it that way.
How did that change over time, or how did you overcome that barrier?
The insurance companies are what changed all of the things because of audits. And then if they flagged us and it was a specific doctor, then it would flag the doctor also. So the insurance companies, because they held the payment for either services or in both cases, you know, the prescription or the medical service. So the insurance company was the big mover for changes because of the money involved and how everybody got paid.
Did you ever take over owning your dad's store?
No.
Or
No.
so you never owned?
It would be almost impossible to own a private pharmacy because of the profit margin and the return, and the insurance companies are what they control the patient population. It was just way too complex to be an independent, and my hat is off to anybody that operates an independent pharmacy and continues to make a living at it. But it's like any owner of any business. You're married to it and you just don't have a life. Like I said, because I was in the family business, I didn't have any sick time. I didn't have any vacation time. And that's because the owner didn't have those things either. As soon as I got a job and had, wow, I got vacation. Huh, this is great. But I still couldn't bring myself to call in sick. It was ingrained.
Was calling in sick like frowned upon?
No.
Or
No, it was just something that
you weren't used to?
that I was, it's not so much that I was used to, I just didn't believe in it. Somebody hired me for a reason, and I just felt that I needed to be there.
Were you ever a pharmacist during any of our country's wars as either a civilian or military occupant?
The Iraq wars were the first time that I was exposed to any type of correlation between pharmacy and the military. I didn't work for the military, but I had pharmacists that had served in the military. So there was really no, I didn't have exposure to either the military or the influence of, trying to think, I worked for an Indian reservation one time, but that wouldn't be military.
Okay. Now, you talked a little bit about your father's pharmacy, about the soda fountain and things, and I was going to ask because I know a lot of the images of older pharmacies are like the soda fountain and all that things. Like, could you talk more like about the comparison between your father's pharmacy back then and like a pharmacy today, for example? Like, I know a lot of the pharmacies have the pharmacies all the way in the back.
Correct.
So was it the same back then, or?
The configuration of most of the independent pharmacies that had the soda fountain motif or whatever, they were configured the same way. I remember there was a lot of people that are pharmacists that opened a pharmacy, and pharmacy was not their forte, and they would open an ancillary business inside the pharmacy that would probably supplement or equal more than the pharmacy was making. Of one guy, there's a pharmacy, and it's still there at Mount Holyoke, and he was a bibliophile, and his pharmacy became the Odyssey Bookshop.
Oh, wow.
So because he was in the middle of Mount Holyoke College, that he was able to probably, and I don't know for sure, but he probably had an in with selling textbooks. But I've been in the Odyssey Bookstop, and it was pretty unique. I love bookstores. Anyway, and then there was another pharmacist who had an ancillary business of unfinished furniture. And then I ran into a pharmacist that no longer worked as a pharmacy, but he sold banjos.
Oh, that's pretty cool.
That was pretty cool.
So, like, I know a lot of people nowadays, like, don't feel really comfortable talking at a pharmacy because everything is so tight and confined, and you don't want to share your business. Did you find like people back then, was it more open and people were more willing to talk with you and things?
It was unbelievably open, and what struck me as one of the really, sometimes it was a burden because people would trust you and they would tell you things that, because they trusted you, first of all, you didn't want to hear it, but you would listen because you were a confidant. And a lot of times, and I can remember, they would tell me things that they wouldn't tell their priest.
And this is things that sometimes aren't even pharmacy related, I'm
Oh.
guessing.
Almost nothing in the retail pharmacy in the conversation had to do with, the prescriptions that you were filling at the time, because you were part of their family. It was more than a tradition. It was an institution. If you had a community pharmacy that had a footprint for more than 10 years or 15 years, and like I said, my father was in that store since 63 to 92, so that was over 30 years. It was an institution, and I still run it. Last week I ran into somebody that I remember going to the soda fountain. I remember buying candy from your dad.
That's pretty cool.
It is really cool.
Now, going back to the, you said you were drafted, and that was before you went to pharmacy school.
Correct.
Now, how long did you serve in the military for?
The draft was only a 2-year requirement.
Oh, okay. And that, I'm assuming you went to Vietnam.
I
at
did
that
go to
time.
Vietnam.
Now, was that kind of a culture shock for you going from Massachusetts to the jungles?
That's service in Vietnam is something that it's not really related to pharmacy.
Mhm.
So
Not really want to go into it, or?
I'm not going to go into that.
Okay, no problem. Let's see. Now, back then, I know, what were like the main medications about the time when you were working at your father's pharmacy?
Oh, of course the big company was Eli Lilly,
Mhm.
and they're still a major player, but they're not as big as. Actually, your generic companies became bigger than the big name companies. Eli Lilly and their Keflex, and then of course Boehringer. They're the Lasix people.
Mhm.
And so the question was,
It was like the main medications, like were there like
oh, diuretics
big
and
names
antibiotics.
okay.
Diuretics, antihypertensives, diuretics, and mostly antibiotics.
Mhm.
Antibiotics. Oh, you know, at the time when I first started pharmacy, even Benadryl was a Schedule 5 prescription. So you would need a prescription for Benadryl. You need a Dimetapp. Almost all of the stuff that you see in the over-the-counter variety or on the shelves was on prescription at the time. So the type of things that people are able to self-medicate with now, those were the type of prescriptions that you were filling, aside from the antibiotics and the cardiac medications or antihypertensives.